Hi, this is Jees. This is April 8th, 2020, 9 p.m. CST. It's a Wednesday, and cases continues to increase all across the globe, and deaths has actually, in a way, we can see that it has peaked in the United States, but in other countries it is on a rise. There are some countries which are showing hope, but there are countries like United States and United Kingdom which are seeing the active spreading of this infection, and the death rate is proportionally increasing. So I'll give the update about myself. I think I'm pretty good at this moment. I have been using all the social distancing measures, trying to work out whenever I can, going for a walk, and all the related stuff. So far I'm doing pretty good. Another update is like we got one of our grocery deliveries today. It was a home delivery. It went very smooth. We got all the stuff that we have asked for without any replacement even. That's like great. Second, my parents, I talked to them today morning. I think the things in India is like getting a little worse, but actually in the state where I stay, there is actually they are trying to contain the disease very well. So that is good news amongst all the bad news that we are getting from everywhere. Talked to my brother, sister-in-law and kids. All of them are doing great. They are seeing a decrease in their actual number of cases in their county. So I think that's a good sign for them, but we don't know really how it is going to pan out in a couple of days. How are they going to extend the stay in-house orders? It all depends upon how do they stay at home before they can completely contain this disease. I think I'll go into my friends' details. All of them are doing pretty good. I think all of them are isolating themselves, so they do not have any symptoms, and they have completely engaged. They are completely engaged in their research work and stuff. The thing after this, I'll just go to the total number of cases. I think you can see. So I have added one more metric to this thing, which is the total number, and the number which is coming up today. So the total number of cases has gone to 1.5 million. That was pretty fast to go to 1.5 million. So 84,384 people are infected today. 88,495 people have died in total from COVID. 6,414 people died today. 330,000 people have recovered, and the number of active cases is 1 million. That is like the number that we are going to battle in a couple of days. 1 million people are still infected, either seeking their either they are recovering at their hospitals or they are recovering at home, which is also one of the gravest concern for us, because I think this may cause a spread within the family. So during the later detail, we will mention a couple of the researches that has helped us to understand how the disease spread through the air, how the aerosol transmission is done. So I'll link that video, so I'll give you updates about this in the later part of this video. Today's video is going to be a little longer, but I think it will be containing a lot more information that we need at this moment that we do not get mostly from our day-to-day updates. I'll go into the number of cases by country now. So United States has 434,000 who are infected so far. 31,935 people who are infected today. I think this number has gone down from yesterday. Spain, 148,000 people, 6,000 people were infected today. I think that number, after seeing a constant decrease for 4 days, and we are seeing this number once again going up a little bit, so it's a little bit of concerning for us. Italy, 139,000, 3,800 people are tested positive today. That number is going down I think more than 4 to 5 days. That's like really consoling. Their social distancing is working, and it's like great for us to understand that fact. Germany, 113,000 people are infected in total. 5,600 people are infected today. I think that number has gone up, and today you can see that the place of the France, which was usually the fourth one, is taken up by Germany today. in total number of cases. France has 112,000 people, 3,800 people were infected today. That number is actually very less. This France number is fluctuating by a large margin, so we do not know exactly what to predict. Yesterday it was close to 6,000 or 7,000, I'm not sure, but I think that number is very different from the number that we are seeing today. We'll go into the number of deaths by country. Italy has so far the highest toll. 17,669 people have died so far. 542 people have died today. That number is again going down for the maybe for the fourth or fifth consecutive day. That's like really consoling once again, as I said before. Spain, 14,792, 747 people have died today. That number has gone up. It's just the trend. We have to see the trend line, what's going on. In the United States, 14,788 people have died in total. 1,940 people died today. That number has gone up. Yesterday it was 1,970 people. But with the United States, you have to also highlight the fact that many of the deaths that are happening in the households in the United States, especially in the New York area, are not being counted as COVID. But they do recognize that these deaths are or may be related to COVID. There is an increase actually in the number of deaths that happens inside the homes in New York, which are largely detected by the other departments of the public health, not necessarily by the hospital. So they are seeing, usually there used to be cases of 30 to 40 deaths a day, but actually now they are seeing these numbers increasing to 200 deaths a day. So they are planning to accommodate all these values in the later calculations. We will see that reflections in a couple of days. But I will link the details of the link in the video, in the description of the video. But hopefully that is the case, and we will see this addressed in coming days. So these numbers, 1,940 is the number of people who have been accounted who are dead in the hospital. There might be numbers which are slightly bigger than this, but that has been always the case for a couple of days. France, 10,869 people have died. 541 people have died. Today that number is going down, but this, as I said before, France, this number is always fluctuating by a large amount. Yesterday this number was somewhere around to 1,400, 1,200. So we cannot assume anything about France. So we will have to take the average of the 2 days and then try to find this trend line. UK on the other hand, having 7,997 people who are dead from COVID so far. 938 people have died just today. That number is really alarming. This number is going skyrocketing for UK. The measures which they have been taking, we do not see at least the effect of it coming in direct proportion to the number that we see every day. So that is the story with the UK. I wanted to mostly highlight a couple of facts in this video today. So one of them is how is the aerosol transmission of these droplets are coming. In one of the very famous experiment by an MIT professor, Lydia. So she in 2008 has explained how the aerosol transmission happens, especially in communicative diseases like this. These diseases have a potential to actually spread through the micro droplets that we emit when we talk, when we cough, when we sneeze. They have an extreme potential to go beyond the measures that we can imagine, that we have never imagined before as human beings. So they say that without any protection, without any mask, if you speak generally or breathe for that matter, the droplets in your saliva on your mouth can go up to 2 meters ahead of you. This is directional, so it has one direction. So it goes directly in almost the forward direction. It goes up to 2 meters. That is the range that you have, every human being has. So basically that means that anybody who is within that range can actually get the virus, according to the new study. But there are other problems like, how much is the elevation, will the droplets drop because of the gravity? That all are under discussion, under the consideration. But we are sure that 2 meters it can reach just by breathing. But if you sneeze or if you cough, If you cough, it can go up to 4 meters. And on the very bad situation, if you sneeze really bad, it can go up to 6 meters. So the precautionary measures that WHO encourages under the light of these active research is actually not so encouraging. So they are encouraging 1 meter distance from the person to have a social distancing safe distance. But we see that these numbers are not even matching with the state-of-the-art research, which I'm picking it up from 2018, which says minimum 2 meters is required for the basic breathing. So if you're running, if you're not static, that distances increase by many fold. So if you are actively biking, if you're actively running, so people are asking yourself to be distancing about 10 meters from the other person. This is the new standard. The measures which WHO is publicizing is actually not helping a lot. It might help slightly, but I do not think, it's my personal opinion, I think they have to be a little more forceful in exerting these measures. That is from coming out of the research of Lydia from MIT lab. They have explicitly measured these things under slow motion cameras, and then they have proven it that this is going to be the effect and this is going to be the range. So I think we should all take a look at it. I am linking that along with the description. The second big question is coming up from the economic front. So nobody really knows what are the economic impacts that we're going to have. That is one of the biggest things. So there are a lot of speculation around. But I would say it is too early for us to predict anything for that matter. So what are the things that might affect us, that might help us? One of the things is that people are actively talking about the kind of recession that we might have. Recession is obvious. Anybody without any understanding about the market can really see that there is going to be a recession. That's what many of the researchers have already said. Even the famous Nobel laureate from MIT, Abhijit Banerjee, also said so, because it was very clear and evident. He said that everyone can easily predict. That's what he said. But what are the economic reforms? What are the important aspects that we can be sure of? Or like what are the important things that we are not sure of, so that we can get some insight about it? So one of the things is that how much is the immunity going to last? All those people who are infected are now, we perceive them as immune people. So these people, how much is their immunity? How long is their immunity? How much strength do they have for a second wave? These all depend upon the kind of infection that they have, the kind of antibodies they have produced. This kind of will simulate or stimulate the economy sometimes. One of the things is that. Second thing is that any medical intervention, either it is preventive or it is during as a reactive, in any of the cases, any medical advancements can actually bring back the economy a little bit. How are we going to transition? We are in a majority of the world is in a lockdown. Majority, by which I mean large population of our globe is under lockdown. So how are they going to be brought to the mainstream market? Are they going to be doing it in single shot? Are they going to do it in multiple shots? These are all the questions that we need to answer. Will there be a second wave? And one of the things that we are increasingly seeing in this scenario, especially in the United States, is like many of the countries, many of the companies are incentivizing their employees. They are trying to install protective shields for people in the supermarket or in the grocery chains. Many of the companies are paying them extra, like Aldi, Whole Foods, Kroger, to name few, but a lot of them. Target is hiring a lot of people. Walgreens is hiring a lot of people with a lot of incentives. Some of the employees are even getting the incentive of full-time employees. Some of the people are getting the incentive of paid sick leave. Starbucks is giving them paying the employees who are not able to come to the work. I think these are all important economic moves that might stimulate the economy very slightly, but very importantly affecting large number of people. The economic stimulus from the government might help small scale businesses. These are all important factors that we need to factor in at the moment. But I would like to I should just show the Economist headline. It says clearly closed. That's the only front line tag that they have. So basically, this is what we are seeing. The effect of economic lockdown is going to be really harsh, but I think we really don't know how it is going to come back. That is even more surprising. Feds has the largest amount for the reserve, so it's almost 5 trillion. So that these are the numbers that we are looking at. These are astronomical numbers, which we all know, which we cannot comprehend in normal sense. So I think we'll have to play this day by day. Once the transition, how it's going to happen, we have to see all these factors, and it is not going to be easy. So first of all, we might have to move the workforce first. We might have to put these people in the workforce really faster, some of the people at least. Then we have to release all this entertainment and all this related industries to come up slowly, and then probably and finally you have to get all the essential. Secondly, you have to start all the transportation system open up really fast, and if you can contain the disease, and then start up all the entertainment industry. So that will be a natural course that I am seeing, but this might be completely wrong. It's like I'm just using my basic knowledge in in understanding how the market works. But this could be a separate video for this thing. I'm not sure how can I do it and when can I do it, but I'm saying that there are a lot of information that we need to process in order to really understand the economic impacts. Apple is releasing, many of the companies has come forward and then try to make face shields for the employees and stuff, but Apple and Tesla, Ford, these people are manufacturing the face shields for the employees. That's really great. Twitter CEO has pledged $1 billion for the economic reforms. These are all economic incentives that come and then help the industry to revive and to come back to its original form. I think I'll not make it longer, but I think I'll cover the economic impacts totally in separate video other than this. So we hope to see a better day tomorrow, hopefully. So these coming 2-3 days are the days in which we have the peak. So we will see how it goes from the peak. Bye.